Hi, my name is Marisa Tobes, and I'll be spending a little time today discussing my team's project titled Creating a Framework for Anti-Racism Pledge Writing in Medical School. Thanks for being here. This past year, I had the pleasure of working with several of my colleagues to create a pilot program through the Kern Institute's Transformational Ideas Initiative. While efforts do currently exist to increase diversity in medicine, U.S. medical schools are in need of more programs to support underrepresented minority trainees and reinforce institutional commitment to anti-racism. Recent research shows that underrepresented minority students often faced racist and discriminatory learning environments that pose barriers to this commitment. Our project details the creation of a program to increase feelings of inclusivity among underrepresented minority medical trainees. After meeting with nearly 30 key stakeholders at our institution to identify incoming student needs and potential barriers, our team designed a pilot program for incoming first-year medical trainees. Incoming medical students were asked to first meet in small groups to discuss local health equity issues and disparities in Milwaukee prior to writing personal pledges surrounding diversity, equity, and inclusion to complete during the M1 year. Students will then reflect on these statements at 6 and 12 months post-pilot, in addition to answering surveys at each time point to assess feelings of inclusivity. Our analysis revealed that 85% of M1 students responded to our optional baseline pilot survey by writing personal pledges. Of those that responded, 81% mentioned a culture other than their own in their pledges, while 48% specifically mentioned an underrepresented minority group in their pledges. Two examples of submitted personal pledges are as follows. The first reads, "I will show up for myself and my fellow classmates by embracing difficult discussions/topics, by fostering respectful, trustworthy relationships with my peers. I will ensure that my peers feel comfortable to use their voice around me and know that even if we have different backgrounds or disagree on certain topics, it does not mean that we cannot discuss them or learn from each other's experiences." The second reads, "I will attend events to learn how to best advocate for underrepresented minority individuals and volunteer within underserved communities to advocate for patients from disadvantaged backgrounds." Because data collection and analysis is still ongoing, our team is unable to make conclusions about the entire pilot project. However, our initial analyses suggest that our framework for anti-racism pledge writing provides medical trainees the opportunity to take tangible action towards anti-racism and supporting their underrepresented minority peers. Medical student leaders might consider advocating for these values to support concrete change at their individual institutions. Thank you so much for your time in listening to this presentation. The project team is excited to continue data entry so that we may be able to make more meaningful conclusions about our pilot project as a whole.